Hey everyone, my name is Lindsay, and for today's current event, I'm going to be discussing how the rising cost of prescription medications are negatively affecting our senior population. Whether the cost of the medicine itself or insurance purposes, prescription drugs can be a strain on the budget for everyone in our population. However, as we all know, seniors, when they retire, no longer have an income. Their only source of income is through Social Security or fixed income through other means, and because of this, it makes it difficult for them to afford medications. Another factor in this is that when you are elderly, there are more health concerns that you come in contact with, which means in a lot of cases more medications that you need to be on. With this rising cost in the amount and the cost of medications that you're required to be on, as well as your decreasing income, it really makes it difficult for a lot of our elderly people to afford their medications. And so what this article kind of discusses is how these high cost of medications are affecting the day-to-day lives of some of the elderly people. It discussed how a woman is still paying for her deceased husband's medications 2 years after he had already passed away, just due to the high cost of his medications. One of those medications being insulin, which I've discussed before is one of the highest cost medications for a disease called diabetes, which is, if you have type 1, something that could have not been prevented. It's autoimmune, so to ask these people to pay this large of a price for a medication that they require to live just doesn't really seem fair. Another thing that this article discusses, though, is government programs that elderly individuals can become a part of in order to help afford their medications. So they have a few options as far as either changing to generic brands or changing insurance, or finding programs to help them afford some of these medications just due to the high cost and the amount of medications they're on, as well as their decreased income.